This is a video in clinical medicine from the New England Journal of Medicine.
Insertion of an arterial catheter is a common procedure in critical care units. Ultrasonography may be used to ensure safe and successful insertion of an arterial catheter. This video will demonstrate the use of ultrasound guidance for the insertion of a radial arterial catheter in adults. Arterial catheterization allows for the continuous recording of arterial pressure measurements and can be used to adjust the doses of vasoactive drugs that are administered for hemodynamic support in critically ill patients. Arterial catheterization also provides easy and convenient access to arterial blood when arterial blood gas sampling and other laboratory tests need to be performed. Ultrasound guidance can be more effective than palpation for the insertion of an arterial catheter in patients with obesity, edema, hypotension, or vascular abnormalities such as tortuous vessels. In general, the use of ultrasound guidance for the insertion of a radial arterial catheter is faster than the palpation method and has a higher success rate. Also, successful insertion is achieved after fewer attempts, which means that there are fewer attempted sites of insertion, thereby minimizing patient discomfort. There are no contraindications to the use of ultrasound guidance. However, radial arterial catheterization is contraindicated in patients with infection of the skin or soft tissue at the insertion site, severe peripheral vascular disease, impaired collateral circulation, or severe coagulopathy. After obtaining the patient's consent for the procedure, gather the necessary equipment. You will need 2 pairs of sterile gloves, a mask, a sterile gown, a skin preparation solution such as chlorhexidine, sterile drapes, 1% lidocaine without epinephrine, a 5 cc syringe and a 25 gauge needle for delivery of the local anesthetic, and angiocatheters. Radial arterial catheterization can be performed with standard angiocatheters or with safety angiocatheters. Use the equipment that complies with the safety practices at your institution. You will also need a sterile ultrasound probe cover with sterile gel, sterile gauze, and materials for dressing and securing the catheter. You will also need a pressure bag, a pressure transducer, and a monitor that is appropriate for arterial catheter transduction. In order to assess the vasculature, you will need a linear array transducer ultrasound probe with a frequency range of 5 to 13 MHz. Wash your hands before touching the patient and put on the mask. Position the patient's wrist so that the forearm is flat. Put on a pair of sterile gloves and use antiseptic solution to wash the skin of the patient's forearm from the wrist to the antecubital fossa. Discard the gloves, wash your hands again, and put on the gown and a new pair of sterile gloves. Drape the patient, exposing only the cleaned forearm from the wrist to the antecubital fossa. Have an assistant clean the ultrasound transducer with an antiseptic wipe. Apply sterile gel to the inside of the sterile sheath and cover the ultrasound probe without contaminating the sterile gloves or the sheath. Remove any air pockets from around the probe, which if present will cause poor quality ultrasound images. Make sure that the left part of the ultrasound probe corresponds to the left side of the ultrasound screen. Starting at the wrist, scan the lateral aspect of the forearm in the transverse orientation and identify the radial artery and associated veins, which will be located between the styloid process of the radius and the flexor carpi radialis tendon. If necessary, apply light pressure to help differentiate the artery from the veins. Veins will collapse while the artery will not. Have the assistant adjust the gain and depth of the ultrasound machine so that the artery appears in the center of the screen and is clearly visible. As you scan the artery from the wrist to the antecubital fossa, look for arterial tortuosity and calcification. Locate a section of the artery with a large diameter and minimal calcification. To prevent the development of kinks in the catheter after it has been inserted, choose a site that is proximal to the wrist and distal to the elbow. Kinking can occur when the patient moves or is repositioned. After locating an appropriate site for catheterization, slide the probe so that the artery is centered on the screen. After anesthetizing the skin, insert the angiocatheter covered needle at the middle of the probe at a 45 to 60 degree angle. Slide or tilt the probe towards the needle tip until you can visualize the tip on the monitor. Make small bouncing movements with the needle to locate the tip. As you advance the needle towards the artery, tilt the probe in the direction of the needle's trajectory to ensure that you can see the needle tip at all times. Reposition the tip periodically to confirm that it is directly above the artery. Insert the needle tip into the arterial lumen and examine the angiocatheter for flashback or blood return in order to confirm its position. Flatten the angle of the angiocatheter and then re-examine the area on the ultrasound monitor to make sure that the needle tip is still in the artery. Slide the catheter over the needle into the arterial lumen. Apply pressure proximal to the catheter, remove the needle, and attach the catheter to the transducer. The catheter can also be inserted in the longitudinal orientation. To do so, begin the procedure with the ultrasound probe in the transverse orientation to locate the artery. Center the artery on the ultrasound screen and then rotate the probe 90 degrees. You should see the artery in the center of the screen with a view along its long axis at its maximum diameter. Insert the angiocatheter at a 15 to 30 degree angle at the exact midline of the long axis of the probe. Advance the needle parallel to the long axis of the probe. If you do not see the needle, it is probably medial or lateral to the vessel. Pull back on the needle without withdrawing it completely or letting it leave the skin, and readjust the angle so that you can see the needle tip on the ultrasound screen. Then advance the needle again until it is within the lumen of the vessel and look for flashback in the angiocatheter. Slide the catheter over the needle and into the arterial lumen. Apply pressure proximal to the catheter, remove the needle, and attach the catheter to the transducer. The main challenge when performing ultrasound-guided catheterization is visualizing the needle tip and differentiating the needle tip from the needle shaft, since both will appear as white dots on the screen. Novice operators sometimes believe that they are visualizing the needle tip on the monitor, but they are actually viewing the needle shaft. In such instances, the unseen needle tip has been inserted more deeply than the operator assumes and can cause injury to deeper structures. For this reason, visualization of the needle tip at all times is crucial during angiocatheter insertion. It is easy to learn how to use ultrasound guidance when performing radial arterial catheterization in either the transverse or the longitudinal orientation. Clinicians who regularly insert arterial catheters should master this technique because it can increase the success rate and reduce the number of attempts required for successful catheterization as compared with the palpation method.